So, healthcare leaders are known for identifying and solving problems. But what if the real problem isn't solving them? It's understanding them correctly in the first place. Good morning. I'm Bruce Spurlock. I'm a physician and healthcare leader committed to helping physicians and decision makers navigate change with clarity. On viral healthcare, we examine the trends and ideas that are spreading throughout healthcare, what works, what doesn't, and what it really takes to implement them effectively. Today, we're going to be talking about identifying the right problems. Now, our last episode, we spent a fair amount of time understanding the early warning signs about a new innovation or a new idea. Is it hype or not? Today, I want to spend more time making sure that the kind of solution we're talking about will actually fit the right kind of problem. And sometimes that means making a bigger effort at trying to understand the problem. So let me set the context for all of this. Healthcare leaders are clearly problem solvers. I know most of the time you get up, you go into the office, wherever you're going to work, and you're dealing with problem after problem. And that's kind of what you get a lot of experience, a lot of on-the-job training, a lot of practice, making sure you're involved with that. You fix issues, you drive improvement, you deliver solutions. And I got a feeling that most of you take a little bit of pride, at least I do, when I can solve problems and solve them quickly. And it's interesting because our culture, our reward system, what we value in healthcare leaders is that decisiveness, is that like action oriented, we can get things done kinds of activity. But we're not really always wired to solve, not always wired to step back, pause, and make sure that we're dealing with the right problem. So that's the hidden risk. It's solving the wrong problems. And some problems exist for years and years and years, despite repeated effort. And sometimes it's out in the system and sometimes it's us. So why is that? Why do we have multiple attempts? It's kind of like a smoking cessation. It doesn't take just one quit effort. You have to have multiple efforts. And that's sort of the same way that we attack problems in healthcare. So some of it's because we jump to the solutions way, way, way too quickly, or we define the problem too narrowly, or we actually have this thing where we can simplify, which in general is a good thing in problem solving, but sometimes we oversimplify in order to be able to get our arms around something that's relatively complex. But you can see the same pattern time after time. It's the same issue, a new initiative, a new solution, limited improvement. Oftentimes there's some improvement, not a lot, but some limited improvement. And then you repeat or you find a new solution. What I'm talking about today is less problem identification and more problem diagnosis. So healthcare is really good at identifying problems. I can't tell you how many times I've been with executives, I've been with committees, I've been with boards, and we show metrics and dashboards and we show all sorts of information. And people sort of say, oh, red, yellow, green, I can see the red. And so that's easy to identify the problem. But when you start peeling back the layer, usually the solutions are, oh, we think this is the problem, or we think this is the problem. So we're going to try this. We're going to try that. We're going to try this. We're going to try that. And it really doesn't have a deep understanding of it. There's these improvement plateaus in many organizations. I don't know if you've seen it. I've seen it a ton. I'll bet you've seen it in your organization where you get some improvement, you get some things happening well, either in a new initiative or something that you're targeting, and then it flattens. Or maybe it even backslides a little bit. And that's part of the problem is we don't really know what we're really solving for. We're really good at sort of let's describe the problem, but let's not necessarily understand all of the root causes. And I use an S on the end of root cause. It's not root cause, it's root causes, because the vast majority of issues that we're dealing with have multiple factors involved. And that's the problem with oversimplifying. We think we can get to the choke point, the one issue that we just flip and suddenly things are on. I've seen that a few times in my career, but more than likely it's multiple multiple actions going on that we have to deal with. I'm going to talk about this in a couple of minutes, but Mary Woods in Scotland, she's a professor in Scotland, she coined this term that I really thought was good. There are organizations that are comfort seeking and organizations that are problem sensing. And sometimes when we get these plateaus or when we get these really quick answers, it's because we're trying to find out how we're doing things right rather than deeply, deeply understanding it. Or we get a solution and we say, well, then this must be a problem that we have to deal with, rather than saying, okay, here's a list of problems. How are we going to identify the optimal solutions for this? So identification is really what's happening, and a diagnosis is why is this happening. And in fact, like a physician, you may actually need a differential diagnosis, and this is the complexity piece that I'm alluding to. It may be that it's again, several things, or we think this is what's happening now because we have limited information. As we go down the testing or implementation pathway, we may discover new activities, and we don't want to make the same biases, same problems that happen in diagnostic error. There are cognitive biases that occur there. Same thing happen in decision making for organization and how we test and try out new solutions and try to understand problems. We can make the same kind of diagnostic errors in that setting. So don't stop too early. Actually, widen or broaden the potential differential diagnosis of what's going on. And that'll keep you from jumping quickly. And that'll keep you from closing off possibilities that may seem remote, but actually, as we get into the next stages of things, we see more possibility. Okay, one of the things about the problems that I've seen is sometimes they're structural problems. So it's in all of healthcare. It's throughout the United States or even internationally. A good example is we don't have enough primary care providers, and there's no question about that. And we don't have enough in all of the right places, especially in rural America. We don't have enough primary care problems. That's really a systems issue. Yeah, there may be some local factors. There may be some things that one organization is more desirable than another organization. So there may be some asymmetries locally, but really the absence of enough primary care practitioners is universal. And it's interesting, in the United States, we're going through this process where we are giving all of these 50 states money to help identify rural workforce issues. And clearly one of those are primary care practitioners. And everybody's going after a diminishing source of that. It's going to be challenging to solve that structurally because it's just a universal problem. There are ways to do that. We'll talk about that in a future podcast, in this one in particular, because there are solutions that look at those structural problems. But that's one of those ones that it's harder to get our arms around. That relates to sort of payment models or regulatory constraints or just simple industry-wide efficiencies. And this is a good example of that, is where improvement efforts or where you actually save costs don't fall to the organization doing the work. They accrue somewhere else, either in Medicare, in a health plan, or in society in general, and not the ones that are identifying sort of the problems. And then there are local problems. And this is one of the ones that I like to look at when, if you have something that's plateauing or if you're not making progress, is everybody else getting it except for you? Or maybe there are a handful of organizations that are really excelling and you're in the middle of the pack. And that may be really more about your organization, and that may have to do with culture or leadership decisions. Or one of the things we found is that not all throughout the organization are you the same. You think that leadership drives this culture, leadership drives this system throughout organizations, and yet we find great variation within organizations, and not just in healthcare, but in other industries as well. So sometimes the structural problems look like local ones. Sometimes local problems look like structural problems. It's really important to identify, is it our problem or is it everyone's problem as we think about it? Now, sometimes when we're talking about issues and problems, they're bigger than they really are. I find this a lot when there's a vocal minority. It's a board member, or it's a very vocal member of the medical staff, for example, or maybe you have some outspoken people in your community that are raising a ruckus about things. Sometimes it's just sort of the nature of that advocacy that those loud voices feel a lot bigger than they really are. Sometimes we respond to that. I mean, we're just humans. We're looking for solutions and we feel a pain point, but the pain point isn't really distributed evenly. The pain point probably is more of an issue with a particular anecdote or a very localized situation, and yet we give it a disproportionate amount of time to be able to do it. So the question is, are we reacting to noise? Or is this a pattern? Is this a problem that's a little more universal? And the noise is just the tip of the iceberg. I think that's one of the diagnostic tests for you to think about. Visibility does not mean importance. Volume does not mean it's a scaled issue. What really needs to happen is is this noise or is this reality? It's just a real difficult problem to think about, but sometimes you have to spend the time doing it. Okay, I alluded to this earlier, this notion of solution-oriented versus problem-oriented organization. And that's really kind of interesting. A solution-oriented organization, you would think, is really powerful. And sometimes we need to do this. You need to move quickly to action. There's a lot of need for decisiveness. Sometimes you launch a lot of issues, or you're looking for that next big best solution. I think something like that works well, like during a pandemic or a cyber attack, when you have to act really quickly to be able to deal with situations. That's not frequent in healthcare, as we know. They do happen, they are required, but most of the time we're not in that rapid phase. And so solution-oriented organizations often oversimplify. It's less about did this solution work to what is the next part of the next solution, or how do we get to that? In fact, sometimes people don't even know they have problems until they see someone else talking to a solution to a problem, and then you go, whoa, I guess we do have a problem. That's okay, but really what we're talking about is moving to becoming a problem-oriented organization. This is where you spend a lot of time trying to understand the issue. And we've talked about this before, analysis paralysis. I'm not talking about that. I'm talking about taking a look at an issue and a problem and trying to really understand the roots of it and the multiple roots of it as we go, asking deeper questions, talking to more people inside and maybe even outside of the organization to really get your arms around it. So it's sometimes perceived as slower, but really it's what you need most of the time. So it's not an either or, it's situation specific. And the vast majority of things that we're talking about in viral healthcare do not need that decisiveness, do not need that rapid action. Most of the things we're talking about are the ones that you can actually spend a little bit of time trying to understand. And it may be months that we're talking about doing it rather than just a few days or weeks. Now I want to go back to what I talked about earlier, that Mary Woods crafted. And I really think this is an important thing. It's a step beyond what we just talked about with problem-oriented versus solution-oriented organization. And this is what she calls problem-sensitive versus comfort-seeking. So let me talk about comfort-seeking, because I have a suspicion some of the organizations that are out there that you're involved with have some of this going on. So the question is not what's working, but not what's not working, but what solutions are working. Where do we see evidence of progress? Where do we see evidence that we made the right decision? Where are we getting feedback that in fact we're doing everything we can? And sometimes it's the way people talk at committee meetings or board meetings. You can hear there's a little bit of, maybe it's, I don't feel completely safe raising an issue, or I don't feel like I'm going to be rewarded if I bring up a potential problem, or everybody's going to look at me like I'm the devil's advocate. And we really say, man, the CEO is going to promote the people who are creating solutions rather than the people who keep identifying where the organization falls down, where we have potential great risks, those things. It's kind of interesting to think about how that happens in the comfort-seeking organizations. I've been in many. It's human nature. You don't need to feel bad about it, but it's something that takes effort to really think about. A problem-sensing organization goes and looks for it. They actually try to figure out, where are the problems? Where are the potentials? They might on walk rounds, or they might look in those Kaizen activities where people go to the Gemba or go to the floor, wherever you're going, that you really ask more questions about problems than trying to find out where things are working really well. It's not a problem to ask about solutions and success. That's okay to do that, but it's the emphasis and the focus on there's another problem right around the corner and we just need to uncover it, understand it, and we want to be able to reward people for thinking like that in the first place. So this is really important to think about problem sensing. Problem sensing is often shown when there's variation. So when one part of your organization is doing really well, another organization isn't doing so well, that's actually very valuable information. Why? What's happening? Where is it going? What are my assumptions? What's going locally? What's happening leadership-wise in those different parts of the organization? Problem sensing is a key way to think about it in futures in your organization. So ask yourself simple questions, and you have to slow down to do these asking. Where is this happening? Where are things working and not working, and why? When does it happen? Who is affected? It's really interesting. This is more about pattern recognition. It's kind of interesting. It's really trying to look at like this mosaic of different patterns and say, what can I pull out of that? What are the common features of those patterns? It's simplification without oversimplification, because it recognizes that there may be multiple components to this pattern. So why is all of this important? Why am I spending so much time on the diagnostic side of problem sensing and problem-oriented organizations? It's because until we really get our arms around it, we're not going to be successful. It's going to waste resources. We're going to create initiative fatigue. I've mentioned this before. We're going to lose the trust of our frontline organization when it's just the flavor of the month, the new fad, the new thing that somebody went to a meeting heard something about. If we spend more time with diagnosis, and especially this concept of differential diagnostic components of a problem, we're going to be able to target solutions and test solutions in a targeted way. Oh, it didn't seem to go that way. I wonder if it's this number 2 or 3 thing on my list of potential components of a solution or problem that we need to target. You're going to get better outcomes. People are going to understand it, and they're going to expect that not every test or not every implementation is successful. If you sort of lay out that here's the set of issues that we're trying to deal with, we're not going to tackle them all at once. We're going to tackle them individually. They're going to actually cut you more slack when things don't work out so often. So it's important to be able to do that. If you think about trends and hype and fads, all they do is they're trying to look at something common across the board, but to get them really, really implemented well in your organization, to make them sustainable, to make them last, to actually have a chance at success with implementation, you have to spend more time and deep thinking on what is the problem. Don't oversimplify. Make it manageable, understandable in that pattern, but don't go too far with it. All right, so that's a fair amount of information and content for today. If this resonated with you, take a moment and look at your own organization. See what problems you're trying to solve and ask yourself a little different question. Are we solving this, or are we trying to understand it? Do I think it's complex or it's simple? Have I identified several factors that might be involved, or do I think it's just the next solution because the last one didn't work so well? The quality of solution is only as good as the accuracy of the problem. So that's kind of where we're getting at today. Now, if you like this conversation, if this resonated with you, join me each Tuesday on these LinkedIn Live, or you can follow Viral Healthcare on your preferred podcast platform. Now, next, I'm looking forward to the next one. On the next episode of Viral Healthcare, we're going to look about organizing better systems for diagnosing problems. How can we look at something systematically and not just react to them? So that's about building systems that can be moved throughout organization, move within organization as well. I want to thank you for listening to Viral Healthcare. If this conversation was helpful for you, share with a colleague who's navigating change. And if you'd like more thoughtful conversations about ideas shaping healthcare, be sure to follow the show and share your ideas. Give me your questions. I'm really anxious to do that. If you've got a problem that you're trying to solve, if you've got a solution that you stopped because it wasn't working, I'd love to hear about it and talk to you about those kinds of things. I'm Bruce Spurlock, and I'll see you next time.